Bismillahirrahmanirrahim. Quote of the day is: do good and serve your mother, then your mother, and then your mother, and then your father. This is the quote from by Prophet Muhammad ﷺ to emphasize the significance of status of mothers in Islam. My name is Dr. Aamna Khalid, and I will be presenting the topic of MCH. We will go through the introduction and then the maternal and child health programs under the kind supervision of Professor Dr. Saira Afzal, who is the Institute of Public Health, Lahore. Learning objectives for today's presentation are: we will go through the overview of maternal and child health and explain the importance of MCH, describe the maternal health components and then the child health components, and we will understand what are the programs for maternal and child health, identify key challenges, and then the practice of MCQs. So, maternal and child health is a specialized field of public health which focuses on the health of women during pregnancy, childbirth, and postnatal period, and the newborns, infants, children, and adolescents. It also includes family planning, nutrition, and health education. MCH aims at survival, growth, and development. Scope of MCH is the maternal health services, newborn and child health services, adolescent health, reproductive health and family planning, nutrition and micronutrient supplementation, prevention, promotion, and rehabilitation. Mothers and children are biologically vulnerable, so that's why it's important to focus on MCH because there is high risk of morbidity and mortality in both of them. Majority of maternal and child deaths are preventable. The MCH indicators reflect the socioeconomic development of the country and the health system efficiency. Healthy mothers produce healthy future generations. Maternal health remains high in low and middle income countries. The major causes of maternal mortality are hemorrhage, hypertensive disorders, sepsis, unsafe abortions, and most deaths occur during delivery and within 24 to 48 hours postpartum. If we see the global burden, then the majority of under 5 deaths occur in uh, the neonatal period, and the leading causes in them are prematurity, birth asphyxia, pneumonia, diarrhea, and malnutrition. Malnutrition is an underlying cause in many of the deaths. These are the components of maternal the health: antenatal care, intranatal care, postnatal care, family planning, maternal nutrition, and health education. The antenatal care, which is provided during pregnancy, um, the objectives are early detection of high-risk pregnancy, prevention of anemia and infections, health education of mother. The key services provided in this period are the registration of the pregnant female, monitoring of blood pressure and weight, the tests like a hemoglobin, urine test, tetanus toxoid vaccination, iron and folic acid supplementation are given during this period. So WHO recommends a minimum of 8 contacts with your healthcare provider during the pregnancy. Counseling for healthy diet and physical activity is done during pregnancy. Management and treatment of common pregnancy symptoms like heartburn and nausea. Access to essential testing and necessary medical interventions for both the mother and baby. Recommended blood tests and vaccinations, including tetanus toxoid. At least one ultrasound scan before 24 weeks gestation. This is the early ultrasound. And counseling on use of substances like alcohol before and during pregnancy. The intranatal care is the care provided during labor and delivery. Focus is on the skilled birth readiness, clean and safe delivery, timely referral in case of any of the complications. The emergency obstetric care is provided for the management of hemorrhage, eclampsia, or the obstructed labor. Postnatal care is the one for provided for first 48 hours, which are critical. This period includes the care like monitoring mothers for the complications, counseling on breastfeeding, family planning advice, neonatal care, and prevents maternal and neonatal deaths. Uh, Components of child health are essential newborn care, immunization, nutrition, growth monitoring, and management of childhood illnesses and adolescent health. One concept is essential newborn care, which is the immediate care provided to the baby after birth, and it includes clean cord care, thermal protection, early initiation of breastfeeding, infection prevention, and neonatal resuscitation if it's required. These are the major components of essential newborn care. The first one is immediate drying. Using a clean, dry cloth, thoroughly dry the baby, wiping the face, eyes, head, front and back, arms and legs. Then skin to skin contact with mother. Place the newborn prone on the mother's abdomen or chest, skin to skin. Then the third one is proper cord clamping and cutting. Clamp and cut the cord after cord pulsations have stopped, typically at 1 to 3 minutes. Put ties tightly around the cord at 2 centimeters and 5 centimeters from the newborn's abdomen. Cut between ties with sterile instrument. Observe for oozing blood. Do not milk the cord towards the newborn. After cord clamping, ensure oxytocin 10 international units IM that's given to the mother. And the fourth step is non-separation of baby from mother and breastfeeding initiation. Observe the newborn, consult on positioning and attachment, and initiate the breastfeeding. Then the next thing is immunization that protects against vaccine preventable diseases. That's one of the most cost-effective public health intervention, and it reduces morbidity, mortality, and disability, and it's part of the primary prevention. Then nutrition is an important component in MCH. Exclusive breastfeeding for first 6 months, complementary feeding after 6 months, and continued breastfeeding up to 2 years. Then micronutrient supplementation may be provided like vitamin A, iron, or zinc, and the nutrition, if provided timely, can prevent malnutrition and infections. So the care for first hour is that early initiation of breastfeeding should be done within 1 hour of birth. Then for first 6 months, there should be exclusive breastfeeding for the first 6 months of life, and there should be introduction of nutritionally adequate and safe complementary solid foods at 6 months, together with the continued breastfeeding up to 2 years of age or beyond. Then another thing in MCH is integrated management of childhood illnesses (IMCI). This is a strategy by WHO and UNICEF, and it targets for the diseases like pneumonia, diarrhea, malaria, malnutrition, ear problems, and it focuses on the case management, health worker skills, and caregiver education. One approach used in the maternal and child health is life cycle approach. The health interventions are done at each stage of life, which includes pre-pregnancy, pregnancy, childbirth, newborn, then infancy, childhood, adolescence, because early interventions improve lifelong health. This is the life cycle approach that the care should be given at each stage of life, starting from the newborn, then child, adolescent, who become a pregnant woman later on, and for newborns, neonatal uh, ICU units should be established, immunization, diarrhea management, nutrition, early and exclusive breastfeeding. For childhood, there should be in continuation of breastfeeding, and district early intervention centers should be established, immunization, nutrition, cognitive development, diarrhea management, infant and young child feeding. Then for adolescents, there should be skills programs, adolescent friendly health services, immunization and nutrition again, and the menstrual hygiene management. Then for the pregnant women, there should be antenatal care, safe delivery, postnatal care, preparedness and complications readiness, prevention of parent to child transmission of infections, early breastfeeding, capacity building of providers. Then in men and women who later on become the parents, There should be family planning products and services, nutrition, reproductive health, infertility, cervical and breast cancer screening. Another concept is the continuum of care. Continuum of care is similar to the life cycle approach. That care should be provided continuously across the time and place. This concept links the home with community and health facility, uh, starting from the pregnancy to the childbirth, postnatal, and the childhood period. It prevents actually the dropouts from care. So this concept again says that care should be provided at the each stage of life, adolescence and before pregnancy, then pregnancy and birth, and postnatal period for both the mother and newborn, and the maternal health and the infancy continuing to the childhood. So there is integration of the three components: hospitals and health facilities, outpatient or the outreach services, family and community care, and appropriate referral and follow-up should be done. Role of family planning in MCH because it prevents unwanted pregnancies, reduces maternal mortality, it prevents teenage pregnancies, promotes optimal birth spacing, and improves maternal and child nutrition. Adolescent health component in MCH because adolescents are the future parents. So the key concerns in this stage are anemia, early marriages, teenage pregnancies, reproductive health education, and it breaks the intergeneration cycle of poor health. Gender and women empowerment because educated women seek healthcare early, make informed decisions, and women empowerment will improve nutrition, childcare, and health seeking behavior. Community participation because the community involvement ensures program success and it includes the mothers groups, community health workers, male involvement as well, and the local leaders. It will improve the acceptance and sustainability of the MCH programs. Monitoring and evaluation of the MCH programs with the important indicators used are maternal mortality ratio, neonatal mortality ratio, infant mortality ratio, under 5 mortality rates. These actually help assess the effectiveness of programs. So to see the graveness of the problem, the maternal mortality ratio um, from the data of 2020 is shown in this map. And Pakistan is in the range of 100 to 200, and you can see that the deaths are 154.2 per 1 lakh of the live births. This is the infant mortality rate from the data of 2023, and Pakistan is in the zone of 2 to 5%, and exactly it is 4.94%. Although it has decreased with time till 2023, but still uh, it needs to be focused. Then a few of the programs for the MCH services in our country. The first one is Lady Health Worker Program, which was launched to strengthen primary health care at the community level. It targets maternal, newborn, and child health, especially in the rural and underserved areas. The objectives of this program are to improve access to the basic health services, reduce maternal, neonatal, and child mortality, promote family planning and immunization. The key services provided by the lady health workers at the doorstep are antenatal and postnatal home visits, identification of high risk pregnancies, family planning counseling, growth monitoring and health education, referral to health facilities when needed. The significance of this program is that it's the backbone of Pakistan's primary healthcare system and it bridges the gap between community and the health facilities. Another program is Maternal Newborn and Child Health Program. This is the national program focusing on the continuum of care. It addresses the health needs from pregnancy to childhood. The objectives of this program is to reduce the maternal mortality ratio and also to reduce the neonatal and under 5 mortality and improve quality of obstetric and newborn care. The key components are the skilled birth attendance, emergency obstetric and newborn care, strengthening health facilities, and training other healthcare providers. And then EPI is the program, expanded program on immunization, which was started in 1978. This is one of the most cost-effective public health programs. The objectives of this program are to protect children against the vaccine-preventable diseases and to reduce the morbidity, mortality, and disability in children. The diseases covered are tuberculosis, polio, diphtheria, pertussis, tetanus, measles, hepatitis B, pneumonia, rotavirus causing diarrhea, rubella, and typhoid. This is a complete schedule starting from the birth and then 6 weeks, 10 weeks, 14 weeks, 9 months, and then at 15 months. Different vaccines are given at each age group. Then we have nutrition program which addresses maternal and child malnutrition, which focuses on the prevention of micronutrient deficiencies. The objectives of nutrition program are to reduce undernutrition and stunting, prevent micronutrient deficiencies, and improve infant and young child feeding practices. The key interventions done in this program are promotion of exclusive breastfeeding, complementary feeding education, vitamin A supplementation, iron and folic acid supplementation, and management of severe acute malnutrition. Then the program is a family planning program, which is the integral component of maternal and child health, and it focuses on the healthy timing and spacing of pregnancies. The objectives of this program are to prevent unwanted pregnancies, reduce maternal and infant mortality, improve maternal and child nutrition. The services provided through this program are counseling on contraceptive methods, provision of modern contraceptives, birth spacing education, male and female involvement. This was all about today's class. It was actually an overview of the MCH, and we will go through the detail of each and every component of MCH in the coming classes. So now we come to the practice of MCQs from today's presentation. The first question is: a 24-year-old pregnant woman in a rural village receives antenatal advice, iron tablets, and referral for danger signs through home visits. Which MCH program is most likely providing these services? Option A, MNCH program. Option B, EPI. Option C, nutrition program. Option D, LHW program. And option E, family planning program.
D.
D.
Yes, option D is the right one because they are doing the home visits. Question number 2. A newborn is kept warm, breastfed within 1 hour of birth and receives clean cord care. These interventions fall under option A, antenatal care, option B, postnatal care, option C, essential newborn care, option D, IMNCI program, and option E, nutrition program.
B.
C.
This is actually the essential newborn care because uh, we uh, we studied about the 4 important components of the essential care, newborn care, which almost all of them are mentioned in this. That newborn should be kept warm, breastfed within 1 hour, and receive clean cord care. These are the components of essential newborn care. Then the question number 3 is: a district hospital strengthens its labor room, ensures skilled birth attendance, and provides emergency obstetric care. This best represents which program component? Option A, LHW program. Option B, MNCH program. Option C, EPI. Option D, nutrition program. And option E, family planning program.
B.
B.
Yes, option B is the right answer. They have the focus on improving all the services for MCH. Alright, now we come to the question number 4. A child presents with cough, fast breathing, and poor feeding. The health worker classifies the severity of the disease and provides the treatment with counseling. Which strategy is being used? Option A, EPI. Option B, essential newborn care. Option C, IMCI. Option D, nutrition rehabilitation. And option E, family planning.
C.
C.
Yes, option C is the right answer. The child might be suffering from pneumonia, so the healthcare assess, classify, uh, provide treatment, and with counseling. These four are the components of IMCI. Question number 5. Reduction in under 5 mortality through prevention of measles and pertussis is best achieved by option A, IMCI, option B, nutrition program, C, MNCH program, D, expanded program on immunization, and option E, family planning program.
D.
D.
Option D is the right answer. Yes, option D is the right answer. Through vaccination, we can reduce the mortality. Question number 6. A public health officer explains that improving adolescent girls' nutrition today will reduce maternal deaths in the future. This concept best represents option A, continuum of care, option B, life cycle approach, option C, primary prevention, and option D, health promotion, option C, selective prevention.
B.
Yes, option B is the right answer. Question number 7. Is a 19-year-old newly married woman is counseled to delay her first pregnancy and adopt a contraceptive method. This intervention primarily aims to option A, reduce neonatal infections, option B, improve immunization coverage, option C, prevent high-risk pregnancy, option D, improve child nutrition, and option E, reduce infant mortality directly.
C.
C.
Yes, C is the right answer. Question number 8 is a child receives BCG at birth and measles vaccine at 9 months. These interventions are categorized under option A, secondary prevention, option B, tertiary prevention, C, health promotion, D, specific protection, and E, rehabilitation.
D.
D. D.
D is the right answer. It's actually prophylaxis. We are giving vaccines, so it is specific protection. Comes under primary prevention. Question number 9 is a pregnant woman receives tetanus toxoid vaccination during antenatal visit. The primary objective of this intervention is to prevent option A, maternal anemia, option B, neonatal tetanus, option C, postpartum hemorrhage, option D, low birth weight, and option E, sepsis in pregnancy.
B.
B.
Yes, B is the right
B.
answer. B is the right answer. Question number 10. A district uh, reports increased institutional deliveries after upgrading labor rooms and training midwives. This improvement is most likely due to strengthening of option A, LHW program, option B, nutrition program, option C, MNCH program, option D, family planning program, and option E, EPI program.
C.
C.
Yes, C is the right answer, MNCH program. So this is the answer key to all of the questions. This is the YouTube channel of Institute of Public Health Lahore, where this presentation will be uploaded later on. And thank you.
Thank you very much, Dr. Amna. This is a very nice presentation. However, there are few important points to note. Number first, the abbreviations should all be avoided, even if they are very common abbreviations like EPI, MNCH. Still, the abbreviation either should be given in the end as a slide or it should be given in footnotes. Number second, important thing is that the maternal and child health issues that are currently we are the signatory of universal health coverage, that we have to achieve the sustainable development goals of mother especially and child health. And also we have to decrease certain important health problems and improve the environment and climate that can affect the mother and child health. So these important goals, we should make a slide where do we stand now. So this part has been messed out. However, overall it is a good presentation. So I am really glad that Dr. Amna Zaman, Dr. Aisha Amin, Dr. Kamran, and Dr. Temia. They are very regular and they are continuously taking part in their professional development and learning. So thank you very much everyone for joining in. And Amna, please make a slide and share with me. And yesterday, Temia, you have to make a slide and has to share, but still I am waiting. So please, both of you should make a slide how the universal health coverage and the sustainable development goals, we have to achieve these important goals, targets, and key performance indicators. And where do we stand now? And after making a single slide, please share it with me. Thank you.
Thank you so much,
Yes,
ma'am.
ma'am.
Thank you, ma'am. Thank you
Thank
so
you so
much.
much, ma'am.